Heart valve disease is a rapidly moving field, and the treatment options available to patients have changed dramatically in the last 10 years. International guidelines in Europe and in the USA provide a platform for practice across the world and need to be updated every 4 to 5 years to take account of new evidence and new treatment options. In 2021, the European Society, in conjunction with the European Association of Cardiac Surgeons, produced guidelines which for the first time encompass the need to involve patients increasingly in decisions regarding their treatment. And this was a very important step forward in the 21st century, allowing shared decision-making across the spectrum of heart valve disease.
I think it's important that patients should be invited to take part in their treatment because, they are responsible for themselves. And I think it's reassuring to play an active role in their own healing process. And in addition, a participation in the process also minimizes anxiety and uncertainty for the patient. And if patients are involved, they are aware that an interdisciplinary heart team takes care about them and are discussing the right treatment decisions for every individual. Well, for me as a patient, that feels calming.
As the disease progresses, there may be the need for intervention by means of heart valve surgery or keyhole or transcatheter alternative treatments. These decisions are difficult and complicated, even for physicians, and it's important that physicians involve patients and their family in discussions regarding the need for the treatment, the timing of that treatment, and the choice of the appropriate mode of intervention for an individual.
Well, I think the decision about the best treatment for the patient is based on many factors. It should be considered what is important personally, and it should be brought into the discussion with the doctor. So this could be things, for example, like, what does my lifestyle look like today? And what are my plans for the next 12 months? But also, think ahead of the next 10 years. For example, what is the likely impact of the different options on my daily life in the future?
So what is shared decision-making? Well, it's a process, it's a conversation. It's inviting patients and their families to be part of making a high-quality decision through the exchange of information. It's about providing, first of all, understanding what are patients' priorities, preferences, and values in terms of how they want to be treated, what are their goals of care. But it's also about understanding what are their options and what does the science tell us are the very best ways to treat their heart valve disease. So shared decision-making is something that's easier said than done. And I think we're all learning how to do it and how to do it well. So don't hesitate to ask your questions, to state what is important to you, to seek clarification, and to make sure that your heart team functions to meet your heart needs.